Hello, this is Julie Fast. I'm here to talk today about how I manage my hypomania when it shows up. I'm somebody who's not able to take full-time medications. I wish I could. If I could, there's not a question I'd be taking them. But because of excessive weight gain and a lot of the other side effects I get that are sort of abnormal. In fact, one of my amazing doctors, Dr. Stephen Jurgen, once called me a side effects queen. I use medications when needed. I was on Lamictal for about 7 years, and that helped immensely. And now that my depression is a lot better, I'm having some more problems with hypomania. I know why I'm hypomanic right now. So I just had a wonderful trip to Philadelphia where I worked with healthline.com. I highly recommend their site. It's one of the top sites for health information. They also have fantastic bipolar disorder support groups on Facebook. So healthline.com sent myself, Samina Raza, and John Press as bloggers, and we went to Philadelphia to talk about medication side effects and how people can better use medications while managing side effects, etc. It was a wonderful trip. I also got to talk with a group where I'm hoping to put my family program for parents of children with mental health disorders online as a video course. I met with Dr. Jay Carter, who has agreed to work with me on my next book. And I also saw one of my best friends, Elizabeth Schuch, who is the author of More Than Bipolar. Now, for anybody, that's a lot, right? It's a lot. But I slept extremely well the whole time I was there. I didn't drink. I didn't party, which I used to do in the past, but that's done. I was very, very careful about the time zone. I changed over here in Portland, Oregon before I actually got to Philadelphia. And then when I was in Philadelphia, I was already on a Portland schedule. All of that I did correctly. I had a lot of trouble in the airports with anxiety and a lot of issues with the fact that, as some of you know, I injured my back really badly. So I had to get quite a few disability services in the airport and they wouldn't show up and then I'd get anxious. But overall, I would say the trip was spectacular. It's not fair that those of us with bipolar disorder can have wonderful times, and then we have to go through mood swings. But it's a reality. I'm on day 2 of being home, and it's very obvious that my hypomania is here. The first day, I just had my typical reaction, which was, wow, isn't this amazing? I'm not getting depressed after flying. Everything has changed. Life is wonderful. But right then, that's a sign, when you think like that maybe you're revving a little bit. I then went to see my therapist yesterday, and I just talked her ear off. And as she said, it's okay to talk your ear off to a therapist. That's what it's for. But I kept saying, I'm not manic. I'm just talking a lot. And if I look at my health cards, or like the treatment plan that you'll find in Take Charge of Bipolar Disorder, one of the main things I say when I'm manic is I'm not manic. And right there, after I walked out of her office, it hit me. Julie, you just said I'm not manic, but about 4 times. And I felt such an unhappiness come over me, and sort of the despondency you get when you realize that you're in a mood swing and that you're not just doing well, and that euphoria is part of bipolar. It's not a good thing. It's just the flip of a coin. Depression on one side, bipolar on this side. Mania. It's now turning into a little bit more dysphoric mania. I'm finding myself cry a little bit. I am anxious. I started rocking already. So I just went to see my nurse practitioner, the wonderful Julie Foster at Pohala Clinic here in Portland. And I'm honest with her, of course. And I said, you're just going to hear me just jam on this whole time because I'm manic. And I had a lot to tell her, but I was honest. And I said, obviously I'm hypomanic, starting to cry a little bit. This is normal after a big trip. That was a big trip. It was a 3-hour time change. I had 4 different projects going on while I was there. I don't think I could have managed it any better on the trip, and I have no problem that I went on the trip. I just didn't prepare for hypomania. Another person who was on the panel told me that her depression showed up when she came back. So mine obviously is the hypomania. That means that I have to look at getting it calmed down as soon as possible. So last night when I was aware I was hypomanic, I knew that the number one thing I have to do is sleep. So I took extra sleep meds and I got myself in bed by 10 o'clock and slept and made myself sleep. And that meant if I woke up, I didn't get a pop-up. I just made myself go back to sleep. I used my melatonin. And luckily, I got about 7 hours, which is pretty amazing. And that's the number one thing. If you're getting into a hypomania like this and you treat it on your own and you're not using big doses of medications to get out of it, sleep is number one, period. So because I don't have a lot of side effects for my sleep meds, I just increase my sleep meds and make myself sleep. I'll do the same tonight. I'll do it every night until I'm out of this hypomania. Next, be honest with myself. I'm hypomanic. Would you believe that it lies to us? You know, if you're a parent watching this, you're going to think, well, you know you're hypomanic, so why don't you just do something? No, it lies. It makes us think you're finally better. Go buy something. Or Julie, you could really write well right now. You need to just don't do anything. Go have some fun. Go to a movie, etc. Actually, going to a movie might be a good idea because I find movies very calming, as I talked to you about in my anxiety video. And you'll notice I'm not driving, so I'm not driving while doing this, taking care of myself. I saw my nurse practitioner, and Julie Foster is very holistic. And she's a nurse practitioner who completely understands that those of us with bipolar need meds, but we also have other treatments. So I use Stibium, which is a homeopathic remedy that has worked for me in the past. It worked very well for my depression. So now we're trying it for my hypomania. She gave me a shot directly in the liver, and I'm timing this to see if it helps calm me down within an hour. If it doesn't help calm me down within an hour, I then promised and said what I was going to do, which is I will take my lithium orotate tonight. I unfortunately am not able to take a lot of traditional medicines. So even though some people, for example, with this kind of hypomania would take some Seroquel and knock it out, take their lithium and knock it out, I can't do it because I have very adverse side effects. What I do is I get my lithium orotate out and I take a small amount of it and it'll get this out of here, but I know I'll gain weight. And sometimes, and this is what we talked about at Healthline when I was in Philadelphia, and we talked about drugs and drug companies. This is a trade-off, guys. I don't get to just be manic like this. I don't allow it. Of course it's fun. Of course I can have a great time and stay out late, but I don't do that. I don't allow it. Because I know what it turns into. It doesn't stay fun. It turns into nervousness and unhappiness and road rage and not sleeping and not being able to work for other reasons, such as being too nervous to sit down. You can notice really trying to keep my head. If you could see my hands are going like this right now. And as I'm talking with you, I'm trying very hard to stay focused. I am able to do my work when I'm hypomanic like this because hypomania, this is sort of a mild one. I'm able to focus when I get into a situation such as coaching. I calm myself down because this kind of mania doesn't affect my thinking. This kind of mania affects my belief that I'm fine and everything's okay. But I'm still able to calm down, like doing this video, and slow myself down and talk with people. But if this mania got worse, I would cancel any coaching I had this afternoon. This is so rare for me. I just don't have very much hypomania. I'm worried about this turning into depression since I was crying in the doctor's office. So probably tonight is a lithium night. When you have to decide, do I keep off meds and let this kind of mania happen, or do I just go take them despite the side effects? It's a trade-off. My trade-off right now is that I'm moving to Europe in March. It's planned. I'm excited. I'm also writing a new book and I'm going to do a video series. So I've really parsed down my work because too much work makes me sick. And so I've stopped taking new clients for coaching. I'm only working with old clients. I'm getting more organized. So this kind of mania is not a good thing. This kind of mania will scatter me again and say, what, only 2 projects? That's not normal. But I can feel myself fighting in this. So people who don't have mania, if you're watching this, my mind is telling me to jump up and down and go have a good time. It's like there's a jack in the box in my head and the mania is whining, and I could just pop out of it. These are the kind of episodes where I used to meet a lot of men if I were dating, for example, I could literally go meet anybody right now because these episodes are fearless. So you have to create natural fear in yourself about this kind of mania. I teach in my health cards and Take Charge of Bipolar Disorder and Loving Someone with Bipolar Disorder a very strict symptom management plan. I believe it's the only way to manage bipolar disorder. So you'll find that even though I had about half a day where I missed the mania, by yesterday when I was with my therapist, wonderful Robin Laws, the minute I walked out of there and I went, okay, what's on my health cards? It always says, if I say, I'm not manic, am I? Or I'm not really manic, then I'm manic. And so my plan was in place. If symptoms are not caught this early and there's no plan in place, this used to go on for me for months. Isn't that amazing that I knew nothing about it before I was diagnosed? And that's what caused the marriages after knowing someone for 2 weeks, and the excessive drinking and the traveling and just getting on a plane and going to China. So yes, we can manage bipolar disorder. So you're watching me do it right now. Am I bummed? Absolutely. Is it fair? Hell no, this isn't fair. Why can't I just go travel and have a wonderful time and come home, do my work, see my friends without getting sick? But you know what? That's having bipolar disorder. And accepting that is the only thing that keeps me stable, is that this is going to happen. I'm going to call my mom. I'm going to let my friends know that I'm manic. And I'm going to say, if you see me manic the next time I see you, it means I need more meds. I will listen. My wonderful nephew, David, who is 13, he's on board. He knows that if the fast talking and all of that continues, he gets to say, Auntie Wee, that's what he calls me. Auntie Wee, you need to get on your meds. So I'd say I'm on about day 2 of the hypomania. It wasn't present on the plane. It absolutely started when I got back home. I will do everything possible. I make a promise to myself and a promise to everybody who has read my books. I don't let mania take over my life. I stop it, even though I don't want to stop this because I'm feeling high. But I will stop it. I will do it. This is my promise. I wanted everybody to see what this is like, because right now I'm going to show you what it would be like if I just let myself be manic. I'd be talking like this and everything's fine. This is how my brain feels right now, and I'd be using my hands a lot, and I'd say, you know, this mania is awful but for me, but I wish I could have it. And that's what my brain sounds like right now. Part of calming that down, being a robot, which is what I call myself, taking that shot, taking my lithium, is my promise to myself and the world that I will not let bipolar disorder control my life. So if you're out there and you're a bit high or you're down and you're like, I don't want to take those darn medications, I hate them. Well, so do I. But it's a trade-off. So right now I'm making a decision that even if I gain some weight, even if I get tired, even if it means that I have to skip a few things for the next 3 nights, I am going to end this mania. You can do it. I wish you luck. Bipolar disorder can be managed. If I can do it, you can do it. I'm no different. Good luck.